You've tried one brand of drops, and when the relief didn't last, you tried another, then another. If you're honest, there are probably 3 or 4 bottles on the bedside table right now, and they all do the same thing. 10 minutes of comfort, then the grittiness creeps back, and you're reaching for the drops again before lunch. Here's the part that's never been explained properly. Your drops aren't working because the water was never the thing that was missing. It's not the water. And I want to be fair to every bottle on that table, because this isn't anyone's fault. Drops are quick, they're gentle, and for most people they genuinely do the job, which is exactly why they're handed out so freely. For most eyes, that's the right answer. You've just been replacing the wrong thing. Over the next 20 minutes, I'll show you what was actually missing, why some dry eyes water, and the 2-part fix that finally makes the relief last. I'm Mr. Dilraj Sahota, consultant ophthalmologist in the West Midlands with training from Oxford University and Moorfields Eye Hospital in London. And here's the one concrete thing to take away right now, even if you watch nothing else. If you've been using drops for weeks and they're not lasting more than a few minutes, that isn't necessarily a bad drop, and it isn't you doing it wrong. Don't switch bottles again just yet. Keep watching, because you're about to find out why and what actually changes it. And if you find this useful, please like the video. It genuinely helps it reach the people who need it. You reach for the drops because your eyes feel dry. Dry means add water, right? But the tears aren't all water in the way you think. There's a thin film of water on the surface of your eye, sealed on top of it a microscopic layer of oil, thinner than anything you've ever seen. In plain English, your tear film is like a pond with a thin layer of oil floating on top, keeping the water underneath from disappearing into the air. The oil's one job is to stop the water escaping. When those oil glands in your eyelids get sluggish, that oil film gets patchy, gaps open up, and the water underneath starts to leave. That's a leak, not a shortage, a leak. It's the reason every drop you've ever bought seemed to vanish. Think of your own lips on a cold, dry day, chapped and cracked. You don't say, I must be dehydrated, I'll drink a glass of water. You know, without anyone teaching you, that the surface has no seal. The moisture's escaping straight through. Your eyes are the same, and you've been reaching for water. If you've been using drops more than a few times a day for months with no real improvement, that's your sign. It's not the water, it's the seal. Don't panic, and don't switch to a different bottle yet. That's the first piece. So why did these oil glands stop working in the first place? 2 things working together. Part of it is simply age. These glands change over the years, and it's far more common than people realise. By some estimates, around 7 in 10 people over 60 have some degree of this. If you're in that bracket wondering, why now, why me? It's not unusual, you're the majority. Part of it is something you're doing right now, watching this. Every full blink squeezes a small amount of oil out of those glands. That's how the seal gets topped up. But screen focus drops your blink rate, and a large proportion of those blinks become partial. Studies tracking this have found incomplete blinking roughly doubles your risk of dry eye disease. The gland never gets its full squeeze. Over time, it clogs, like a tube of toothpaste nobody's pressed properly in months. If you spend hours a day on a screen, build in deliberate full blinks, properly closing your eyes every 20 minutes or so, not just glancing down. That's a free fix you can start today, before we even get to the rest. So that's the why. So if it's not a water problem, what actually is it? Let me give you the numbers. When researchers look at people with dry eye, around 86% of them show signs of those oil glands not working properly. Meibomian gland dysfunction. Not rare, the main thing. And that oil seal is the main thing slowing evaporation in the first place. Take it away and the water underneath escapes far faster. Fast enough to measure. There's a simple test we use in clinic. A healthy tear film holds together for 10 seconds or more before it breaks apart. In evaporative dry eye, it breaks apart in under 5 seconds. That's measurable, and it's happening every single time you blink. And this isn't just my take on it. The international consensus on dry eye, the report every eye specialist works from, is clear that in this type of dry eye, tears are lost through excess evaporation, not through running out of water. Not a shortage, an escape. It's the reason everything you've tried has felt like leaving a glass of water uncovered overnight. By morning, some of it has simply vanished into the air. Nothing spilt it, nothing cracked it, it evaporated from the surface quietly, the whole time you weren't looking. You don't need to self-diagnose a percentage, but if drops haven't touched your symptoms in weeks, assume oil, not water, until proven otherwise. That changes what you buy next. Why does the drop that you reach for 10 times a day let you down? A standard eye drop is mostly water. It lands, feels lovely for a moment, then evaporates, because it's water, and the seal that should hold it in is exactly what's broken. Some of you will have felt it go one step further, 10 minutes after the drop, no better, maybe even a touch drier. That isn't your imagination. As that water evaporates, it can dilute what little natural oil you had left, leaving the surface slightly more irritated than before. The water's gone and it's taken the small comfort it briefly gave you with it. That's why relief never lasts and why you're back reaching for the drops by lunchtime. You're not treating dry eye, you're topping up a leak. If your eyes feel drier 10 minutes after a drop, that's not you being dramatic. That's evaporation happening in real time, and it's the clue to stop chasing a better drop. And here's the part that should feel like a relief. You haven't done anything wrong. Every drop made perfect sense. Nobody told you which part of the tear film you were missing. Right, let's deal with what you've probably tried already. There are almost 3 things almost everyone reaches for before they see a video like this, and I'd bet at least one of them is sitting in your bathroom cabinet right now. Thing 1, a cool, damp flannel reapplied over and over. Feels soothing for a moment, but it does nothing to the oil. It's never hot enough or held on long enough to actually melt it. And that distinction, warm versus genuinely hot, turns out to be the whole game. I'll come back to it. Thing 2, rubbing or pressing hard on closed eyelids. Understandable, it feels like it should help, but without the heat first, you're pushing on oil that's still solid, like trying to spread cold butter. You'll irritate the skin before you move anything useful. Thing 3, and you'll have seen it in comments everywhere, castor oil on the eyelids. There's actual research here, but on specially formulated sterile ophthalmic castor oil drops, or purpose-made applicators, not from the bottle from the hair and skin aisle. An unformulated oil meant for your scalp isn't what the trials tested, and on the eyelid margin it can irritate the lid or blur your vision. If that interests you, it has to be a product actually designed for the eye. And while we're on home remedies, skip the tea bags too. No evidence, and they can irritate the eyelid skin. If you've tried any of those 3, that's not wasted effort, it's a reasonable guess with no seal in it. Only the proper formulated route has any real evidence, and even that isn't doing the heavy lifting. So what actually works? The fix has 2 parts, and most people only ever get one. Part 1, the oil itself. These glands are blocked and the oil itself has thickened until it barely flows, more wax than oil, and that's not a figure of speech. The natural oil is largely wax to begin with. To move it, you need real sustained heat. And this is the single most common mistake people make. A warm compress isn't enough. It has to be genuinely hot but safe, around 40 degrees Celsius or 104 Fahrenheit, and held there long enough to actually melt the oil. Warm softens nothing, hot melts it. Part 2, what that melted oil is actually for. You're not unblocking glands for the sake of it. The oil is a seal. Melt it, massage it gently out the lids, and you're rebuilding the cover over your tear film. Melt the oil, stop the leak. One honest thing, this isn't a one-night fix. Those glands need several weeks of genuine daily routine before the oil quality visibly improves. Not a single compress and done. That's why so many people give up in week 1 deciding nothing works, when really nothing had been given time to work yet. So if you've got gritty, evaporative type dry eye, genuine sustained heat to melt, gentle lid massage to move it, full blinks to protect the seal, and clean lid margins so debris doesn't clog the glands. Daily. Weeks, not days. Melt, seal, keep it sealed. One more thing that's possibly been confusing you. Your eyes are dry and yet they water. How can a dry eye be watering? When the surface loses water too fast, what's left gets concentrated, saltier effectively. Your eye reads that as an emergency and sends a signal. Flood it now. Your glands dump a rush of watery tears, but those reflex tears are mostly water, no oil. So they land, feel wet for a second, evaporate just as fast, and half of them simply run down your face. So if your eyes water and feel dry at the same time, don't assume it's allergies. That combination points straight to evaporative dry eye. The same mistake made by your own body. Should you at least switch everything to preservative free to be safe? Standard bottles contain a preservative to stay sterile. For occasional use, mild seasonal dryness and a drop now and then, that's completely appropriate. It has a place, and I don't want you binning a bottle that's doing no harm. The issue is frequency. 4, 5, 6 times a day, and that preservative can itself start to irritate an already inflamed surface. So occasional and mild, a standard preserved drop is fine. Many times a day, day after day, preservative free removes one source of irritation. But notice, none of it fixes the seal. And separately, skip the drops marketed to get the red out. They work by shrinking the surface blood vessels. The redness disappears for a moment, the effect wears off. The vessels widen again, often redder than before. That's a cycle, not a treatment. So if you're using drops 4 or more times a day, that's your cue to ask about preservative-free. And if you want a drop to lean on while you do the real work, look for the word lipid or liposomal on the label. Your dry eye was never a shortage of tears, it's a leak. The water's been escaping for years because the seal, the oil, is broken. Every drop you've bought was trying to fix a leak by adding more water. That's evaporation. That's the one thing nobody explained properly. And now you can't watch yourself reach for a drop without thinking of it. The thing that frustrated me the most is hearing someone say they've just had to live with it for years, when the actual fix was never that complicated. Melt the oil, rebuild the seal, stop the leak. And the line I always draw, because it matters. Everyday dry eye is miserable, but it isn't an emergency. A red, genuinely painful eye, not gritty and sore, but properly painful, especially with light sensitivity, or a real change in your vision, is not this. Don't sit at home treating that with drops. Contact your GP, call 111, or go to an urgent eye service. If this has been useful, do subscribe. I work through these exact questions every week in plain English with nothing to sell you. And if you take one thing away, let it be this. The heat is where people go wrong. A warm compress doesn't melt the oil. It has to be a proper, sustained hot one. I've made a whole video on exactly this and how to stop it safely. It's called Stop Treating Dry Eye Wrong, the Warm Compress Mistake. And if you've been told for years it's just drops and nothing else, tell me in the comments how long you've been dealing with it. I read them and they shape what I make next. Look after those eyes. I'll see you in the next one.